More than 155,000 people in Singapore have received their first dose of Pfizer's COVID-19 vaccine.
And because of limited supplies of vaccines globally, Senior Minister of State for Health Janil Puthucheary said there are no plans for early vaccinations for Singaporeans who wish to travel overseas for personal reasons.
We completely understand the anxiety of Singaporeans who wish to travel overseas for personal reasons or who would like to get vaccinated early. At this point, when vaccine supplies are limited, we do need to prioritize our healthcare and frontline workers and seniors for vaccination. We are therefore unable to provide vaccines at this time to Singaporeans outside of these groups and seek their understanding. When there is greater certainty in our vaccine supply, we will consider allowing these individuals to receive early vaccination.
Dr. Janil also told the House that the 4 people who experienced the rapid onset of severe allergic reactions after receiving their vaccinations have all recovered. None of them needed ICU support.
He said they were all in their 20s and 30s and developed multiple symptoms like rash and breathlessness.
As with other vaccines, people who receive the COVID-19 vaccine may experience injection site pain and swelling, fever, headache, fatigue and body aches. These mild symptoms generally resolve within a few days.
Dr. Janil reiterated that Singapore will have the capacity and capability to get its population vaccinated by the third quarter of this year, but it may take up to the end of 2021 to do so, depending on factors like vaccine supply as well as the willingness of Singaporeans and long-term residents to get vaccinated.
Separately, Second Minister for Manpower Tan See Leng said migrant workers in dormitories will be vaccinated by the end of this year, the same timeline as for the rest of Singapore. They will be vaccinated based on the risk level of the dorms they reside in, with those at higher risk to go first.
News editor Karamjit Kaur is here to share more on Singapore's vaccination program. Hi Karam. Karam, perhaps we can start off our discussion with a clarification. Now, back in December, Prime Minister Lee Hsien Loong said Singapore will have enough vaccines for everyone in Singapore by the third quarter of this year if all goes according to plan. But it doesn't mean that the vaccine rollout will be completed by then, right?
Yes, that's right, absolutely. So yes, PM did say that, and even after that, some other ministers also reiterated the same point. So I think what's happened is that many people have taken that to mean that by the third quarter of this year, Singaporeans and long-term residents will be inoculated. So today in Parliament, Dr. Janil, clarified. There are several questions from the MPs, including the leader of the opposition, Mr. Pritam Singh. And Dr. Janil said that we're still on track, in the sense that yes, we are still confident that we can get the amount of vaccines that we need to inoculate everyone in Singapore who wants the jab, Singaporeans and long-term residents. But he did say that it'll take some time because there's a lot of community on the ground work, a lot of engagement going on. We've written several stories about seniors, for example, how MOH and other officials are going door to door to explain the whole process to them, to sort of understand some of the concerns that they have and to alleviate some of these concerns. So that is going to take some time, which is why I would imagine Dr. Janil said that it will probably be the end of the year before the actual process of inoculating everyone is completed.
Right. Well, Karam, Dr. Janil, he also re-emphasized who will get priority for the vaccines, which still remain healthcare and frontline workers as well as seniors, but not Singaporeans who wish to travel overseas for personal reasons. He was answering questions from 12 MPs. So it goes to show there are segments of the population who are clamoring, who are raising their hands to say, I want to get vaccinated early because of whatever reason. So do you expect more of these groups who are not in the priority groups to, like I said, raise their hands to get vaccinated early as, the vaccination program gets rolled out?
Yes, I think for sure. The fact that 12 MPs stood in the House today to raise this really gives you some sort of indication of the sort of feedback they must be getting from their residents. And many Singaporeans still see getting the jab as sort of like a passport to travel overseas. There are many Singaporeans who study abroad. There are many who work abroad. I think given the situation in many of these countries, they do sort of feel that they want that sort of protection. But I think for sure you will get more and more people sort of like eager to get the COVID-19 jabs. I think many of us here in the newsroom are also waiting for the same opportunity.
For sure, yeah.
Yes, and I think the more people get inoculated, and it sort of raises the level of confidence. So definitely we will see. I do expect to see many more people sort of raise their hands and say, when is it my turn? Can I get the jab soon?
Right. Now, we just want to understand the willingness of these people to get vaccinated. Isn't that a positive, right? Considering that the government is in the midst of emphasizing that the vaccines are safe.
Definitely. So I think we're looking at different categories of people here, with the seniors, and I think, people with chronic conditions, for example, that will probably take a bit of time. But I think, if indeed, based on what the MPs raised, in the House today, if indeed a growing number of people are clamoring to get the jab, that clearly has to show that there is a good level of, understanding, and there's a good level of confidence that it is safe. And I think partly that also is because, as more and more people get the jabs, and, we have been told by MOH that the number of severe, side effects, it's been quite low. I think four cases so far of people who've been severely affected, which is a small percentage of the total number. Everyone else who has had the jabs seem to be doing quite well. I mean, mild symptoms here and there. So definitely, the longer this continues, the higher the level of confidence, and that can't be a bad thing.
Right. Well, Karam, all 20 polyclinics from today will offer COVID-19 vaccinations. Already 155,000 people have gotten their first dose of the Pfizer vaccine. That was revealed today as well. So 155,000 gotten their vaccine, hundreds of thousands more to go though. So how far will this initiative, getting the polyclinics on board to give out, to administer the vaccinations, go in helping the entire process, move along quicker, hopefully?
I think it'll go a long way. Anecdotally, we have heard of stories here and there, about queues that can be quite long. I've heard of one or two people who've had their jabs at the Changi T4 Centre, for example, and the wait there, can be hours, because first you have to queue, and then you have to sit and wait for half an hour. So, it started off, I guess, quite small, with Changi Airport T4. There's a Raffles City Convention Centre as well, where the jabs are being administered. And yes, from Feb the 1st, all 20 polyclinics now, are able to do this. But of course, only for people who've been invited and who have made bookings.
You can't just walk in, right?
No. Yes, you can't just walk into a polyclinic and say, please give me my jab. Yeah. They're not going to entertain you, right? Yes. But of course, the more centers, that are available to do the inoculation, it will obviously cut down the waiting time. And it will make the entire process a lot more seamless and a lot more convenient, which has to go a long way, if we want to get everyone inoculated by the end of this year, which is what the target is, right?